welcome to the AD channel. Thanks for watching this video, and I know if you are here, you are either thinking about signing up for the 68 X-ray behavior health technician MOS in the military, either in any of the branches or in the Army, the Air Force, and then what is it called, the Navy. So behavior health technician is in these three branches. So pretty much if you are thinking about doing the 68 X-ray job, behavior health, welcome to the channel, the AD channel. It's all about behavior health technician. Today I'm actually going to talk about how to do a good triage. So how do you do a good triage? That is one of your skill set that you'll be doing almost every day in on the job. So basically in the clinic, you'll be doing most of the time two things: a triage and then an intake. That's why I find it necessary to share this knowledge with you. So I think if you are still in the AIT and you're about to finish or graduate and go to your first duty station, this is going to be a very beneficial video for you, because I'm going to share with you your first thing that you'll be doing in the clinic. Okay. All right. So how to do a good triage. Okay. So as a 68 X-ray behavior health technician, like I said earlier, you will be doing a triage and then an intake. That is all. Most cases. Okay. In most cases. There may be exceptions wherever you find yourself, especially outside the country, due to maybe staffing problems. They may ask you to do other things. So for example, in Korea, most techs get to do like safety assessment, for example. Safety checks, sorry. So safety check is way different. So I don't want to confuse you. We may talk about safety check also different because I have that experience as well. When you enjoy what you do, when you learn on the job, and then you make your providers trust you because you always showing the empathy that you have for patient, and then your documentations are always good. The providers begin to trust you, and then you get to do more. Okay. All right. So just a little bit few about myself so far as a 68 X-ray. Thank God. I signed up to do my Master of Social Work. So I'm going to be in my second year in the summer. Yay. Yes, I love being doing this. I love helping. I see the tangible impact that I make in the life of people that I work with on a daily basis. So if you have the same feeling that you really always want to help people, you are in the right job. Okay. Else, this job sometimes could be very difficult. It could be very challenging. I've seen a lot of techs that sometimes the job challenges them, maybe because they had problems prior to joining, and then maybe somebody sharing of a problem could trigger their history of their problem. Okay, so today I'm breaking it simple to help you, and then we will talk about self-care, something you can also do to reduce something that we call transference. Okay, so pretty much doing a triage. How do you know you did a good triage? Everything you have to do as a 68 X-ray on your first patient that you see is to make sure that you are doing a good risk assessment. Okay, so with a good triage, basically you're going to ask the patient, what brings you in today? What brings you in today? Why are you here today? How can we help you today? Those are like open-ended questions that it's not straight judgmental. It doesn't require a yes and a no answer. It always gives the person enough room to start from somewhere. Trust me, it is not easy for someone to start telling you their problem. It is never easy. So to build a rapport with someone, you have to give them enough reason for them to feel safe to talk to you about their problem. Okay, so that is why that I'm sharing this with you, knowing that one, you are in a position that you can actually make a difference in a lot of soldiers if you join in the army, in a lot of service members, their lives, and maybe sometimes their families as well, if they are dual military. Okay, all right. So making sure you listen to them, very, very, very important. Okay, so what brings you in today? You listen, you pick up the keywords in it. Okay, and then you do a few follow-ups. Okay, so now you know why they are there with you today, and then you ask them, like, how long has this been going on? How long has this been going on? Okay, that could be a follow-up question, because you want to understand why they are here. How long has this been going on? And then the third question would be like, so why did you come today? Okay, so that third question is very, very, very important. It tells you what actually triggered it. Okay, why they came here today. It could be something that has happened just right before they walked in, which is serious. It could be anything. It could be something that has been going on for a very long time, and now they can't deal with it anymore. Okay, so why did you come in today question is very, very, very important. Make sure you do not miss that, because it helps your provider that you staff with also know the person they are going to see, and then why they are there today. Because we all have challenges in our lives. Sometimes we cope with it. We find different ways to cope with it. We will talk about self-care at the end of this video. But yeah, self-care is something that we have been doing on a daily basis that we actually helps us to go through life, right? And then we do it all over again every day. But sometimes you hit that level, and then you just need to talk to someone. You just need to speak up, like to talk to someone, to try to get help from somewhere. And in the military, we have the behavior health, we have the MFLAGs, we have the chaplains, right? We do have the ACS, other agencies on bases that actually provide a lot of trainings, provide a lot of resources to help service members cope through the daily stresses, right? The daily challenges, right? So we have stresses, but when it's becoming a distress, then they will come to find help. Okay, so we have talked about asking the person, telling the person who you are as your job. You are a behavior health technician. You ask the person why they are there today. And then you add a follow-up question. How long has this been going on? And then you also ask, why did you come today? Okay, you want to understand that. That is very important. Why they showed up to the clinic the day you are sitting with them. Okay, and then from there, you do your risk assessment. So risk assessment, are you thinking about killing yourself? Are you thinking about killing yourself? Are you thinking about hurting somebody else? Do you plan to hurt somebody else? Right? So those are very key. You always want to make sure you do not miss that. Okay. So I know I probably skip like limit of confidentiality, which is something you always know. Make sure you don't miss it from the beginning of each session. Privacy statement, limit of confidentiality. So in the military or in the civilian world, privacy statement is the key to doing providing informed care, right? So you're telling the patient all their rights and pretty much how their information, everything they share with you in a behavior health setting will be kept between you, the tech, the patient, and then the provider you staff with. If they have to go and see a psychiatric for medication, that person also becomes a member of the care team. So that is the care team. Okay, so you are in a very critical like position as a tech. You want to make sure you're providing care, you're giving them the opportunity to tell you why they came in today, so we can actually go to the different stages. If there is any suicidal ideations or homicidal ideations, your provider will tell you to do an intake. Okay, so that goes to a different level. an intake. So we will talk about doing a good intake in the next video. So I just wanted to share this because I see new soldiers every day coming in from AIT, and I want them to know what we do as techs when we sit in with the patient. Most of the time, I enjoy when they shadow me, but then it always changes the dynamics of therapy. When you have someone shadowing you, it's always different. Trust me, it is different because the person will feel like talking to two people at a time, even though the person that is shadowing you may not be saying anything, but it always changes the dynamics of therapy. Okay, so you do a good triage because I'm guiding you to know what the questions that you need to know, so you present it to your provider and then you make the decisions from there. If you have any question, just let me know and then we will find a solution to that. So to say thank you for watching this, self-care is very, very important as a behavioral health tech. I'm beginning to share self-care in each video that I do at the end, because I feel like I've seen a lot of people as techs, myself, that we go through some of the challenges, more like transference, okay? Because we listen to a lot of problems, and then these challenges, sometimes the patient may transfer them based off of our conversations that we are having with them, okay? So we need to find a way, coping skill. For me personally, what I do is, after the patient is gone, it's always good for me to go back to the provider and tell them, like, and ask them, like, is everything good? And sometimes, so they will like to share more. It helps me to learn that maybe I need to do something next time when I have a different patient. And then it also helps me to share some of the things that I hear every day. It's a good practice. So if you're a tech, you may find your different way. Sometimes I see techs playing video games, like, you know, when we are less busy, which is a good way for us to actually let some of the stuff we listen on a daily basis go, because it can caught up with you. Okay, so try to find a way to do self-care, which is very, very important. Well, thank you, and then let me know if you have any question, and I will try to get the answers for you. I do talk to almost every tech that I work with, so stay safe and help soldiers out there. See you.